I enjoy interviewing people in the sciences because science is built around discovering good, testable, and self-correcting methods to figure out what's true. In my view, a good scientist retains intellectual humility and frequently entertains the possibility that they are wrong. Science relies on research and data, and I wanted to know how we can figure out when and whether to trust the data that science uses to draw conclusions. Hope is studying biology at the University of Washington, and we had this conversation on Seattle's One Line in December 2024. My name is Nick, and this is Conversations on the Coast. Howdy. Would either of you be interested in doing an interview while we ride the train today?
No, thank you so much.
All right, you bet. Hi, how about you? Interested in doing an interview while we ride the train today?
What's the interview about?
So I do something called street epistemology, which is about critical thinking. So what we do is we talk about some belief that you hold, something that might be important to you that you believe is true, and then we work together to critically examine the reasoning that supports your belief.
Interesting. I've only got 2 stops, but
okay,
I'd be happy
we
to
could
do
try
it.
to we could try to make it quick. Sometimes it goes quick.
Okay.
Cool. So what's your name?
Hope.
Hope. My name is Nick.
Nice to meet you.
And what brings you down to the train?
I'm trying to catch a train to go home.
Oh,
from
okay.
school.
Just normal day-to-day commute.
Yeah.
Awesome. Yeah, me too. I use the train to get back and forth from Rainier Valley to Inner Bay, where I work. So
Nice.
cool.
What do you do there?
So I'm a software engineering manager.
Cool.
Yeah, but in my off hours, I'm a podcaster.
That's
so,
fun.
So thinking about like things that you believe, what's something that you believe is true? Maybe something that you think other people should also think is true.
I don't know. Like, what kind of, things would you say? Or what are you looking for here?
So I've done everything from, like religious and political beliefs to, people's values and things that they care about to, there's one person, an awesome person I met down here on the train who is a reality show freak, and she does all kinds of like data mining about reality shows, and her belief was that you're not a bad person if you watch reality shows, basically.
That's funny.
Like you can be an intellectual and also watch reality shows.
I mean,
right?
Yeah, everybody deserves to have their guilty pleasure.
yeah, definitely. Cool.
I don't know. Sorry, I've been doing a lot of thinking this week about
Yeah.
finals and stuff. So one is not like coming to mind immediately.
Okay. What are you studying?
Bioengineering.
Nice. Cool. What do you hope to do with bioengineering?
I'm hoping to go into like vaccine development.
Nice.
Yeah.
Okay. Cool. What do you like? As you looked over the last few years since the pandemic, right?
Mm-hmm.
Obviously, vaccines have been in the forefront of the news as, it's been contentious, right? And it's surprising, maybe, to people in the biosciences that it's contentious.
Absolutely.
Right? So what are some of the things you believe maybe about vaccines or about, culture and how people are approaching vaccines?
Yeah, okay. Well, I would say that they definitely within the scientific world are very well researched, and
Okay.
if they're FDA approved, they're like safe.
Nice.
And they definitely are designed to make you safer with
Yeah.
whatever they're protecting you from.
So I love the assertion that ties FDA approval with safety.
Yeah.
So would I be correctly stating your belief if I said that FDA approval of vaccines is trustworthy?
Yeah, I would say so.
Cool, great. So I never want to put words in your mouth, right? Because we're going to examine, we're taking this as your belief and we're examining it.
Yeah.
Cool. So what would you say is the main reason you believe that FDA approval is trustworthy?
Because...
I'm not trying to preach, I'm just trying to get the mic.
Yeah,
closer
no,
to
I
your
know, I
mouth,
speak
so-
quietly.
Yeah.
Well, it takes a lot of research and a lot of time working with like clinicians for vaccines to get approval or anything to get FDA approval. And anything that's gotten that far is because a lot of researchers have worked very hard and cared very much about something to make other people's lives better.
Okay.
And it's a very high level of safety that the FDA needs to be able to approve something.
Okay.
Yeah.
Let me ask you this. would it be possible for somebody to put a lot of work into getting a result and still come out with an inaccurate result?
Absolutely.
Okay.
Yes.
So when you look at that belief, and I normally ask this first, but looking at a confidence scale of from 0, meaning you're not confident at all, to 100, it's like you can't be wrong. Like, where would you put yourself on that 0 to 100 scale?
Well, I feel like you can never be 100% sure of something, but I would give it like a solid 99%.
Okay. So going back to your statement about, like, there's a lot of research that going in it, and you've conceded that, you know, you can do a lot of research on something, do a lot of work, and still come out with an inaccurate result. Is that a strong enough reason to support 99% confidence?
Well, it's that, and it's also the peer review.
Okay.
So it's not just one person; it's a lot of people, and they're being looked at. Their work is being looked at by a lot more people as well.
Okay.
Yeah, I don't know. I think it's a very rigorous standard that I would say does support the 99% confidence.
How do you know that it's a rigorous standard?
I, as a bioengineering student, have looked into some like various like clinical research and the various standards they have. So I know it's a rigorous process. Yeah.
Where did you learn this information about the process?
I've looked at a lot of different laboratory websites from various CETA professors and clinicians at like Harborview and Fred Hutch, just as a few examples. I don't know. I've definitely done a bit more reading about it than that, as I was kind of looking into the field in the first place. But the most recent stuff that comes to mind is all UW affiliated.
Okay.
Yeah.
Why are lab websites reliable? What makes them reliable?
Well, there's definitely the fallacy of they are put out by the people who are doing the research, so of course it's biased in that sense.
Okay.
But they are also designed to get you the information that you need to learn more about their website, and it's done by the people who know the most about the research. So, and it's also got links to like all of their publications, and in all of the publications they have like statistical analyses that tell you how relevant or irrelevant their results are.
So are you saying that? And again, I don't want to strawman what you're saying, but are you saying that in order to trust what's on the website, you kind of have to click through and kind of look at the supporting documentation?
Yeah. I would also say that UW is a source I do trust, so I tend to believe something that I read there more faster than I would if I was to find a random website on the internet. You know?
Interesting. Why do you hold UW in such high esteem?
It's a very well-known research university. I don't know. Can have trust with.
Can an institution be well known and still not be acting in good confidence?
Yeah, absolutely.
Okay. So why do you think that UW is trustworthy?
Well, I mean, they are well known for the good work that they do. Not necessarily just how long they've been around, but like a lot of the new medical research that they're doing and how much it's benefited people. Yeah.
So just one more question, because I think this is your stop.
Yes. Actually, no. I have an extra one.
Okay, good. If FDA approval of vaccines was not reliable, how would you find out?
It is good to read about anything you do before you do it, I would say, which would include getting vaccines. If you really, especially like with the COVID vaccines that were approved very quickly, and I can see where people might not be as confident with that.
Yeah.
But you can do the reading about the studies or the journalism. I don't know. Not necessarily
And
the
if
research
it was not
studies.
reliable, that would tell you that it was not reliable? Like, is it testable?
Yes, actually, a lot of studies will do statistical significance.
No.
Pioneer Square. Yeah,
All right.
next one. So, but a lot of studies will have like statistical significance monitors, or like analyses that they have at the end of the papers.
Yeah.
That will tell you exactly what level of confidence they have that their results are working.
Yeah.
And of course, it is a short-term approval.
So these are the studies that support the FDA decision?
Yes.
Okay.
Yeah. Well, on Sandy study you find, but yes.
Does that give you confidence that the decision that the FDA makes is actually legitimate and reflecting reality?
Yeah. Yes, it does.
Okay. Fantastic. Cool. Do you have any questions for me quickly before you
I do not,
run
no.
out? All right. Thank you so much.
Yeah.
You've been listening to Conversations on the Coast, a series from Washington State featuring civil conversations using street epistemology to explore what people believe and why. Find out more at streetepistemology.com.